The gentleman from Florida, Mr. Donalds, is recognized for 5 minutes.
Thank you, Madam Chair. To the witnesses, thanks for being here. I mean, look, here's the deal. We already run a single-payer health system in the United States. It's called the VA system. The VA system has been plagued with backlogs. It has been plagued with long lines. It has been plagued with shortages of care. It's been plagued with overspending. It's been plagued with fraud and abuse. We've never fixed it. We choose not to fix it. But what we're going to say is that the VA system, which we know has not provided the best outcomes for the men and women who have served our country with honor and distinction, we are going to say, instead of fixing that system, we are going to create a much larger system for every American, where our own experience with the VA system has already proven what happens when you have universal coverage. We have another system. It's called Medicare. By and large, it's one of the most popular systems that the federal government has in the United States. It goes insolvent in somewhere between 5 to 7 years. I was actually just in the Budget Committee, and the Director for Office of Management and Budget in the President's own budget, which he just released yesterday, does not show any slowing down of benefits with respect to Medicare, but then also no proposals about how you're going to keep this situation going in Medicare, because we're spending significant amounts of money providing the care to the elderly who paid in through payroll taxes over decades in the United States. But there's no reforms to actually make sure that the benefits can be paid, which means that we're just going to have to dig into the pockets of every American to continue benefits when the money that was actually allocated for those benefits is not even enough to pay the burden going forward. But yet in this hearing, we're talking about universal health care. I remember a video it was a YouTube video from years and years ago. This was back when I was a fledgling political watcher. And it was from a member of our body who still serves here today, who talked about how the Affordable Care Act, effectively referred to as Obamacare, was just the first step towards universal health care. What Obamacare has done, what the Affordable Care Act has done, however you want to call it, it has led to higher deductibles, and it has led to higher premiums in the United States, bar none. I am, of course, because I'm a member of Congress right now, I'm on Obamacare. I've never paid higher insurance premiums than I'm paying right now. I've never paid higher deductibles than I'm paying right now. And everybody I know in my district and throughout the state of Florida, and frankly across the United States, their deductibles are higher, their premiums are higher, their access to care is actually less than it was before the Affordable Care Act. But the answer from the Democrats in our body is universal health care, or Medicaid for all, or whatever the amalgam is going to be. Ms. Turner, you said in your opening testimony that undertaking universal health care in the United States, according to CBO, would be complicated, challenging, and disruptive, quote unquote. The complicated, challenging, and disruptive would apply to all Americans, whether you're black or white or Hispanic, whether you're rich or whether you're poor. You know, it doesn't matter. When you unleash a system that is complicated, challenging, and disruptive, that affects everybody. And where are they going to go? Ms. Turner, I have a question for you. Because of all the situations that we're talking about, can you provide some specific examples of potential stalled innovation in the medical field? What products would be most at risk if America adopted a single-payer healthcare structure?
What are the advantages today and what would be most adversely affected, Congressman?
Yes, ma'am.
The world relies on the United States for medical innovation. We saw it in pharmaceutical research with the vaccines just last year. And when you see the federal government working together to support the private sector and the incredible resources it has in research and technology, innovation, flexibility, that's when you get results. When you have the federal government coming in and saying, this is how we're going to do it, that's when you get the CDC with its failure to be able to come up with a test. We have to have the private sector if we're going to have innovation. And if we're going to have innovation, that's what leads to progress. That's what leads to the miracle cures that we see today, to new surgeries that would have been impossible to envision 30 years ago. So having private sector innovators who are rewarded through ownership of patents oftentimes, but rewarded adequately for their investment in that research is what will solve these problems, to give people more choices of more affordable care and coverage. The Surgery Center of Oklahoma is a perfect example. It doesn't rely on government funding to be able to provide the high-quality care it does. It relies on being able to make the procedures that they do as efficient as possible with the best procedure, with the best physicians, the best nurses, and the best outcomes. That's what we need more of.
Thank you so much, Ms. Turner. Madam Chair, I know I'm over my time. Well, one thing I would say is this. I've long said to a lot of students across the country when I go and speak with them, if the federal government was in charge of the telecommunications industry, we would not have iPhones and Samsung Droid phones. We would still be on the Motorola StarTAC. And their response is, what is a Motorola StarTAC? And I'm like, that's my exact point. It's that funky phone that had the orange buttons and the orange screen. There is no innovation when it comes from the federal government. It only comes from private markets. This is the exact wrong way to go, and health outcomes in the United States would actually be worse. And if you don't believe me, look at the VA system. I yield back.